If you've been having problems with shoulder pain, I want to go over with you what's causing it and how you can wind up addressing it. I'm Dr. Gregg Gerstin, and I focus on helping people to remove the blockages in their health to live amazing, fantastic lives. Recently, I've been getting a lot of comments and questions about why my shoulder pain occurs again and again and again, even after I've done physical therapy, after I've done epidural shots into my shoulder, and even after I've had rotator cuff surgery. So I'm going to go over with you the two tricks that are missing from most programs that really wind up helping folks. So the first thing that winds up getting missed is that there's a disconnect between the brain and the body, and it winds up happening here in the neck. You see, when we wind up looking at the nerves that come out of the neck, we can follow them all out to the shoulder, so they provide strength and energy to the shoulder. If there are any changes within the neck here, it's going to cause this to be weakened. So no matter what we do out here, it's not going to get the sound information that it needs to hold your body upright, to keep that shoulder strong, to coordinate the muscles that are needed to help it slide and glide properly. The second thing that often gets missed is what's called a thoracic hyperkyphosis. That's where this mid-back winds up bending too much. Many times folks will look like this. And the reason that that causes difficulty with the shoulder is that the scapula, the wing back here, when we have a normally positioned spine, is able for the scapula to stay back on the thoracic cage. However, when the thoracic cage rounds, it winds up rotating forward. As the scapula rotates forward, so does your shoulder. So your shoulder gets in a position that becomes mechanically disadvantaged. For things like your rotator cuff, your biceps tendon, they get overworked because they're not used to doing that workload. If you've had challenges with your shoulder and you notice that your mid-back is rounded a ton, or you've had a history of neck pain, you have to have this looked at differently, and a corrective chiropractor is the person to look for it. If you need help with finding someone who can help you with this, go ahead and write down below. I'm constantly checking these videos in the comments to make sure to connect you with the right person to help you. If you know someone who's had chronic shoulder pain, zip this over to them. And if you like health tips on how to live a life of optimal health and well-being, go ahead and hit the subscribe button. We'd love to have you. I'm constantly sharing tips on how to do that. Once again, my name is Dr. Gregg Gerstin, and I wanted to thank you for letting me be a part of your health.